Hello, I am Dr. Sujoy Dasgupta, consultant gynecologist and infertility and IVF specialist. Today I am going to discuss what tests are required in case you are having azoospermia, that is no sperm in semen. Azoospermia means when your sperm count is 0 after semen analysis. But remember, we cannot tell you are having azoospermia just based on one semen analysis. We need to repeat the semen from good laboratory. Good laboratory means authentic laboratory which should check the semen by doing centrifugation. That is special type of technique. Because sometimes even after repeating the test, some sperms can be found in the semen, and in that case the treatment may change. Suppose the second test is also suggesting azoospermia. Then what we need to do? Remember, there are number of tests, but all men are not requiring all the tests. Therefore, we go in stepwise manner. Initially, we do advise some tests, and based on the result of these tests, then we go for next number of tests. Therefore, we advise the men that you may require to come to our clinic repeatedly just for the test for initial 3 to 4 visits. Number one test is that we need to check you physically, that is, we need to check your private areas, the testicles, penis, whether there are any abnormalities in your private area or not. Then we need to check your hormones, FSH, LH, testosterone, blood sugar. Sometimes we may need to check your estradiol and prolactin level. Then some cases, not in all cases, some cases you may require some special ultrasound called USG scrotum, that is the ultrasound of your testicles, and sometimes you may require some special ultrasound called transrectal ultrasound to see your prostate. In this ultrasound, the ultrasound probe is inserted through your rectum, through your anus to see whether your prostate glands are okay or not. And in some cases, you may require ultrasound of your whole abdomen to see whether your kidneys are okay or not. Then, depending on the cause, you may require some genetic test. If it is related to some problems inside the testis, then you have to do the genetic test. Both types of genetic tests are required, that is karyotype and Y chromosome microdeletion. Genetic tests are required by collecting your blood. If the problem is related to some obstruction, particular type of obstruction where the vas deferens, there is a small duct that is attached above the testis. If vas deferens is absent, it can cause azoospermia. And if you find that your azoospermia is due to absent vas deferens, then you require a genetic test called CFTR, cystic fibrosis genetic testing, and that is also tested by checking your blood. In very few men, the problem may be related to some pituitary gland, that is a gland inside our brain, and that gland problem can cause azoospermia. In that case, you require MRI to see whether your pituitary gland is okay or not. But finally, if we find pituitary gland is okay, but there is azoospermia, then we need to check whether there are sperms present inside your testicles or not. This is done by test called trial TESA. That is, we make small cut or you insert needle inside your testicles and we see whether sperms are there or not. If sperms are there, we can freeze the sperms for future use. But please remember, we have to do trial TESA, not FNAC. Sometimes people are doing FNAC just after a single semen analysis showing azoospermia. This FNAC can harm, and FNAC is not very much sensitive test because sometimes even if you have adequate sperms inside the testicles, FNAC can say that there is no sperm. Therefore, we don't advise FNAC if you have azoospermia. Therefore, if you have azoospermia, don't lose hope. Talk to your doctor, do the test in stepwise manner, and in most cases, you can become biological father using your own sperms. There is no need of use of donor sperms. Thank you for watching this video. If you have any query, please don't hesitate to contact us through our Facebook page and YouTube channel. Please like and share our Facebook page and YouTube channel. Thank you.